What's up, everyone? Welcome. Weekly Zoom, weekly free Zoom. So today, a couple of things. One, first and foremost, we do have a course. It's the only course that's going on in May, and we are selling out super, super quick. We definitely have a bunch of passes, all from the courses. It's insane. I was literally just texting, for those of you that know our intern, Gabriella, she graduated yesterday. I'm literally texting her every single day, students that are passing. So really, really exciting times. So course is filling up soon. It does start next week. We have orientation next week for the course as well too. Today, after this, I'm actually doing like a little webinar for, hey everyone, for the course. So if you have any questions regarding the course after this Zoom, literally right after, I'm doing a webinar for that. So if you have any questions, you're gonna be able to ask me directly. So today we've got a couple of great stories that I want to share. Let's start with Jamie, because I was supposed to get her last week and I didn't because she was working. And if you guys have been on our Instagram, she's the young lady whose mom took a video of her while she was checking her scores and her results. So Jamie, where you at? Here we go.
Hi.
Where? Oh, there we go. Oh, look at you, all decked out in work clothes.
Hi, everyone.
So, yeah. Jamie, what course
getting out of work? So I was in the March, April one.
The March, April. You can tell she's from Boston. So you stuck with the course. You were determined to get my green light.
Yes, I was. And I was nervous because I'm like, I don't know if you're going to tell me to push my test back, but you didn't.
I didn't. And you were, how many questions were you?
85 and out.
85 and out. There we go. So took the course. You were progressing really well. You were 85 and out. What is your advice to people on the other side?
My advice to people on the other side is don't give up. You will get there someday. It might not be, it might not be like super quick in the timeline that you want, but you will get there. And trust Dr. Z, because if he tells you you're ready, you're ready.
Yeah.
And another thing I want to tell everybody is when you're in the test and then you get the case studies, don't freak out, because I got them and I was freaking out. I'm like, why am I getting all these case studies? And then I ended up passing, but I literally thought I failed because I got all those case studies. I didn't know what they meant or what was going on.
So yeah, so those are those questions that don't count against you. So yeah, don't freak out about those. But nonetheless, congrats, Jamie. Your mom is awesome. Can't wait to see you guys in Vegas, September or so. You guys said you're coming down?
I think we're coming in September, yes.
All right, well, I can't wait to have some drinks with you and your mom. So congrats again, Jamie.
I know, looking forward to it. Thank you.
You're very welcome. Take care.
Good luck to everybody.
Thank you. All right, so next up is, let's see here. Shirlene, where are you at?
I'm right here.
There we go, Shirlene. So Shirlene is like part one of two for me, because you passed and your sister enrolled after you.
Yes.
So now we got your sister. That's now I got more pressure on me because I got to make that whole household into RNs. So tell me, what course were you in?
I was in the February-March course. I took my NCLEX April 14.
So we had quite the journey.
Yes.
But you trusted the process. You were along with me. How many questions were you?
145.
See, I tell people all the time, 145 does not mean anything bad. As a matter of fact, so many of our students hit 145 and they do just fine. So you were in the February course, 145 and out. Had you taken the exam before?
Yes. Okay. So I am a repeat test taker, and I've tried several other review. Well, not that much, but one additional. When I failed the first time, I was like, okay, I'm gonna try. I want to pass. Of course, we all have the drive. We want to pass. So I did try another review person. It was a lot. It was just like study this, study that. I'm like, I can't keep up. I have a full-time job and I can't study all these materials. So my sister actually found you on NCLEX site that's on Facebook. And I was like, I'm gonna try it. And I called you. And here we are.
There we go. So what is your advice to people on the other side?
My advice to people is to listen to Dr. Z, follow the method, ask Graph. Guys, listen, I got on the NCLEX and the night before I took my test, Dr. Z was actually, I need for you to not study. You can review a little bit. Make sure you exercise, like walk around and sweat a little bit. I did exactly that. Because I was like, you know what? This is my third attempt and I have to pass. I'm in Florida and this is your last chance.
Yeah,
So
3 and
when I
out
got
over there. Yeah.
Yes. So when I got to the test, I was very calm. Surprisingly, I was very calm and I answered all the questions. When I got to number one, I put ask graph, I defined the word, and it was history from there.
There you go.
They got to be consistent and get that green light. Get
There
that.
you go. That green light is money. Look,
Yes.
the thing about it is, I tell people this all the time. Look, we know $4.99 is not cheap. It's not cheap for anybody.
No.
But even when you're done with the 3-week course, look at Shirlene was in there in February and she's been in contact with me even till after the boards. That's the importance of it, is not walking into that exam, especially in her situation. She only had 1 attempt left. That's it.
Yes.
So having that comfort of knowing that I'm not abandoning you and I'm going to be there with you throughout the entire process, from the day you start the course till the day you pass your exam. I don't care. I got people that needed a lot more time and people that didn't need a lot of time, but I'm there for you. That's the difference between me and everyone else out there. So Shirlene, we're so proud of you. We got your sister next.
Yes.
All right. Thank you and good luck. I'll talk to you soon. All right. Next person is Sharon, aka Hyper Chinese Girl, as your classmates know you as. And so, Sharon, where are you at? You can see she's Hyper Chinese Girl for a reason. That's her nickname. So, Sharon, you had taken the exam before as well.
Yeah, I'm a repeat test taker. I passed on my second try, and yeah, whatchamacallit, I was like really solid. By the end of your course, I was in the April of the Saturday, Sunday course. And by the end of your course, I was really confident. And I went in there and I wasn't like really anxious or anything. The difference between the first time and the second time was my attitude. So like the questions that I got the second time, like it wasn't really covered in your materials, but the ask graph and the method worked on it on something that I've never seen before. And then also my advice for the repeat test taker is when you do go into the NCLEX, don't go in with an entitled mentality of like, oh my gosh, like I work so hard and I study so hard for this. I deserve this. Everybody's waiting for me, blah, blah, blah. The NCLEX doesn't care about your feelings, okay?
Yeah.
And like the NCLEX wants to know, what are you going to do at this moment to save this patient's life? They don't care if you have family problems. I was having family problems during the whole April course. But what really helped, another tip is that get a partner, get a study group going, like consist of like 3 or 4 people. For me, I started off with like 15 people, and that was a lot. And then I just kind of like felt really unmotivated because family situation happened. But then my friend Ursula always checked in on me. She's like, hey girl, how are you doing? And like, she didn't even know my situation. But like she and Marissa and Blessy, we were all in a study group, and we did the 440s together to practice the method, because I've noticed that the reason why sometimes one of us couldn't get the question right because we didn't know how to reword the question. So we were practicing the method together. Yeah.
Yes. And Blessy just passed as well too. So your
Yes,
study partner, she passed as well too. Yeah.
Know.
So Sharon, so she's got some great advice that she put in there for everyone. Yeah, the NCLEX really don't care about anything that's going on. Everyone's got a situation. I talk about it in the 7 reasons why people fail this exam. It's a YouTube video, and yeah, ultimately, look, you put in the work, you studied, you stayed in contact with me, you checked in with me. Sharon, we are so proud of you. Congrats. Can't wait to Can't wait to interview your partner, Blessy. I think she's gonna join us next week. So, all right, take care, Sharon. All right, so I had my official first pass from my hometown in Vegas. Monty, where are you at?
Hey, Dr. Z, right
What's
here.
up, Monty? So we represent Vegas. Yes, we are Vegas.
Yes.
So I know exactly where she went to school. So look, what course were you in?
In the March, Saturday, Sunday course.
There you go. So you were in March, you stayed in contact with me, you checked in with me, you got the green light. I was like, you're good to go. Don't worry about it. And you passed how many questions?
75 and out.
75 and out. There you go. So again, you go both ends of the spectrum, you're still good. Stick to the method. So what is your advice for people on the other side?
I would say definitely what helped me, of course, sticking to the method. I had a lot of prioritization questions, so that really helped. Reviewing notes every day and really having that routine set up every day to make sure you have your 440s. Keep in contact with Dr. C, send him your scores so you can see your progress as well, and Dr. C can, stay in contact with you and get that green light ultimately.
There you go. There you go. So we did it. What attempt was this for you?
Second attempt. So
there you go. So look, whether you're a first time test taker or repeat test taker, ultimately we get you through it. So Monty, congrats. You're my official first Vegas pass. So even more special. All right, take care, Monty.
Thank you. You too.
You're very welcome. All right. And the last person actually don't think spent any money with us. Where are you at? Is this the right Genesis? Did I get you, Genesis?
Yes, I'm here. Can you hear me?
There we go. All right. So how much did you spend with us?
So I spent $60. So I bought 2 crash courses. I bought the mental health and the EKGs because
Okay, so you only spent $60 with us, which is not bad. I mean, it's not quite free, but it's not the other end of the spectrum. So how many questions were you and what attempt was this for you?
So this was my second attempt. The first one went 145, and then the first attempt was 145 and the second attempt was 85 an hour.
85 an hour. There you go. $60 spent. That's it. So how did you feel as far as the crash courses and the lectures? Because those are certain things that people don't necessarily talk about. So what did you think in that time frame that you spent the $30 for that crash course?
I thought it was so helpful. The notes and everything, and I went back and forth, and actually I know the mental health is like super long. I think it's like almost 2 hours. And
almost 3.
I actually went back and like I listened to that again and again and again and again, all the podcasts again and again, and even all the YouTube videos, because I heard about you a week after I failed the first attempt. So I heard it by a friend who knew a friend. So it's like the word spreading around. So the crazy part is that the first time that I failed, I got like a paper that most people get in the mail, that it's like, it tells you where your weaknesses are.
Yeah.
And my weakness, the only one that was like underperformed was mental health. So that's why.
Wow.
So here's the crazy part. The second time I went in, and I swear to you, most of the test was mental health, and I was freaking out. I was like, oh my god, what is this? Is a setup? Like, what's happening? Like, nice. I was ready to freak out, and then I was like, okay, but just remember, I wrote down on the little board like ask Raph, and then I also wrote Dr. C, and I was like, just think what he would do in this situation.
There you go. Awesome. Well, Genesis, look, you're definitely a different case than the ones before, but look, again, ultimately we got to it. So absolutely, I'm so proud of you. Congrats. Thank you. I apologize for last week for not getting you on. So thank you so much for joining me this week.
Okay. Thank you so much.
Take care, Genesis. Bye. All right. So a couple of questions that are happening as far as like how to register for the course. As far as registering for the course, it's on our website. Everything is done on our website. So let me tell you something. Oops, that's not the website I'm trying to go to. Everything is on our website. And remember, nobody is going to come to you and give you a WhatsApp number unless it's my cell number. So don't fall for those scams out there. Oops. Don't fall for those scams out there. If anybody reaches out to you and tells you they got test answers, test questions, it's all BS. Don't fall for it, because ultimately it's a scam. They're going to take your money and run with it. If you enroll in the course, if you talk to anybody on Instagram, if you email us and you say, hey, I want Dr. Z's cell number, you're getting my cell number. I make myself very accessible to all our students. That way you can ask me questions before you invest with us. So if you want to register for the course, you can always hit us up on email, DM us on Instagram, and you can come join us for the webinar here after this as well too. So so it's all done through the website. Nobody's gonna ask you to Zelle them or Venmo them. That's all garbage. That's not us. We're an actual corporation. So yeah, and so basically some of the things that come up a lot on board exams are prioritization questions, right? And my method is made so you can work your way up to the right answer. You're going to start to compare one to the other and have an organized approach. So the first thing that I would start with is I would just kind of get an idea of what you're doing with the method. Everyone talks about the method. And I'm just going to briefly cover it, and then I'm going to jump right into Ask Graph, because that's what we're here for, prioritization questions. And I'm going to show you how it applies, and I'm going to use UWorld as an example. So the first thing with my method is you read the last part of the question first. So which client should the nurse call back first? So you read the last part first, and then you put it in your own words. With prioritization questions, those are the ones that end in first, initial, priority, urgent, most concerning, immediate, and report to HCP. So you're gonna see these, you're gonna look at this, which one is most concerning? Which one is the one that you're freaking out about, right? Freaking out about. So the method is used for all questions. Ask Graph is used for prioritization questions. Again, first, initial, priority, urgent, most concerning, immediate, report to HCP. So what am I freaking out about? Well, in your prioritization questions, you're going to be given 4 situations. Could be in PEDS, it could be in the ER, it could be telephone messages. Whatever the situation is, one of these 4 is freaking you out. That's prioritization. One of these things is freaking you out. And in prioritization, most people learn your ABCs, right? Airway, breathing, circulation. I found that to be a little bit too generic, and I started to see patterns in board exams. This doesn't just apply to NCLEX, it applies to the USMLE and the PANCE, which is, I teach the USMLEs, which is our medical licensing, and I teach it to PAs. So people ask me, oh, what are you doing as an MD teaching nurses? And I'm like, wait a minute, I teach medicine. So how is heart failure different for you and different for me? How is changes in potassium different for you, different for me? It's not. Medicine is medicine, right? So yeah, there are certain procedures, but we all need to know it. So the way I look at it is beyond the ABCs, I use Ask Graph. So what is Ask Graph? It's my mnemonic for the things that you're freaking out about, your prioritization questions. And the first one, bar none, above all else, is airway. Airway, airway, airway. What do I mean by airway? Is this the person that has a chronic obstructive pulmonary disease and an O2 sat of 90%? Is this your COPD patient with 90% oxygen? No. This is your person that has certain words, they're coming in and they're drooling. Maybe they're using their accessory muscles. Maybe they've got an inspiratory stridor or a muffled voice. All these are telling us that, hey, something is severely wrong with this person's airway. So if you see somebody with these and they're starting to get anxious and irritable and they've got a stridor, then you're freaking out about it. So what are some examples? How about epiglottitis? Board favorite, right? So board favorite for respiratory, one is epiglottitis, because that child's epiglottis is inflamed and it's going to create airway obstruction. We're gonna have to either intubate or even trach, right? So if you see somebody like that, or you see somebody that's having an asthma attack, right? Their bronchial are constricted. They're using their accessory muscles. They don't have a proper airway. How about somebody that just had surgery around their neck and now starting to see swelling around their neck? It's compromised. It's unexpected. With prioritizations, you should be looking at what's unexpected. Like, what just happened here that I'm freaking out about it, right? So that's airway. The next one is sepsis. So this isn't somebody who's got pneumonia and a temperature of 102. No, this person is unexpectedly ill. They've got a temperature either greater than 100.4 or less than 96.8. So you could be hyperthermic or hypothermic, but for the boards, these are the cutoffs. But there's a triad, right? We do have a military discount. Actually, I'll talk about it towards the end. So just remind me, we do have, I saw that being asked a lot. So we do have a military discount. So we have a triad. What is a triad? There's 3 parameters in sepsis. So you got low blood pressure, increased heart rate, and look for that fever, whether it's hypothermic or it's hyperthermic, right? So what we're looking for is not that person, like I said, that's got pneumonia. No, they've got an infection, no big deal. We're gonna give them some antibiotics. But this is a person that just got out of surgery. They just got out of surgery and now they got purulent discharge from their incision site. And now they got low blood pressure and a temperature of 100.5. So what just happened? That's unexpected. This person is septic. So what are we gonna do with the person that's septic? Are we gonna give them antibiotics first, or are we gonna give them fluids first? Fluids, don't fall for it. So a couple of little distractors on the boards. Infection or a sepsis, we're giving them fluids, then antibiotics. Hemorrhage, fluids, then transfusion. DKA, fluids, then insulin. So don't fall for it. So give them IV fluids. Sepsis. The next one is K, and the K stands for potassium. Changes in potassium. This means that we are either hypokalemic or hyperkalemic, right? So if we're hypokalemic or hyperkalemic, those of you that have come to my EKG lecture will know that potassium predominantly controls what part of the heart? It controls the ventricle. And when you've got changes in potassium, that can throw your ventricle into a cardiac dysrhythmia. And the one that we're freaking out about is VFib, because if you get VFib, you're done, right? Unsynchronized shock. So those of you that come to my EKG lecture know how to look for potassium. And how is potassium going to show up on the boards? You think they're going to give you a lab value of 3.2, 5.7? Sure, they may. But what they're going to try to do is see if you understand that this person is hypokalemic. And how are they going to do that? Well, I tell this story all the time. I'm like, look, when I played football back in Vegas, you run around, and you get dehydrated and you go, coach, I got a cramp. And coach goes, go eat a banana. Why? It's high in potassium. So look for the boards to try and get you with muscle cramps, indicating to you, hey, this person's sitting there watching TV. Maybe they're on a diuretic. Maybe they're dehydrated. And now they're like, man, I got cramps. I got all types of cramps for no reason. Look for potassium changes. The G is glucose, less than 70. They will give you a specific number. And if you see a glucose under 70, you're freaking out about it. Your body's about to shut down. So if your body's about to shut down, you've got to be able to realize that they're gonna become comatose. They're gonna stop breathing. Glucose under 70, our body needs sugar to make everything work, right? Our entire metabolic system is based off of sugar. So if you don't have sugar, you're going to end up dying. So it is one of the 8 that we're freaking out about. The next one is lethargy or grunting. This one is kind of a stretch, but I had to make it work. And so with lethargy or grunting, look for a pediatric patient, because you can't really identify certain signs and symptoms in a pediatric patient. So you're going to have to describe it in a certain way. And the boards are going to describe it with the terms lethargy, lethargic, or grunting in pediatrics. Okay. The next one is altered mental status. So look for that and listen to these words: that's sudden, acute, last hour. This person has become disorientated, confused. What just happened? Why in the last hour did this person all of a sudden not know where they are? They're hallucinating, whatever it is. Altered mental status. We got to figure out what's going on. Peritonitis. Our peritoneum in cases are GI and reproductive tract. And anytime we have, and that's a big portion of our body, right? GI and our reproductive tract. Well, look, if anything goes wrong, that peritoneum is going to get irritated, whether it's perforation, whether it's sepsis, whether it's hemorrhage. In those organs, we're going to see some sort of peritoneal signs. And what are those? Look for the words guarding, rigidity, board-like abdomen. And the last one is hemorrhage. With hemorrhage, look for somebody that has low blood pressure and increased heart rate. So hemorrhage, look for a patient that post-op, right? Look for maybe somebody that had a liver or a kidney biopsy, highly vascular organs. What are we worried about? Why is their blood pressure 80/40 now, right? So this is Ask Graph. Now look, it's not going to work 100% of the time. I'm not like a miracle worker, but it works a lot of the time. Just look for it, right? Look for them to kind of show that this person is developing one of these 8. So great question. I caught one at the corner of my eye. Are these in order? No, they're not. Airway is above all else. That's always going to be number 1. The rest of them, find it. Find it. And I'm going to do some practice questions today. I'm going to go through a bunch of questions here so you can see how I apply it to questions. So kidney, liver biopsy are highly vascular. So yeah, absolutely. And if you do a lung biopsy, guess which one to Ask Graph we're worried about? We're worried about airway because we can cause a pneumothorax, right? So yeah, there are these things that the boards will throw at you and you can see what it's going to lead to. So let's do a few questions here and I'll go through about 15 to 20 questions so you can see how I do my prioritization. And the other is, what if there's 2 of them? And we're probably going to see that, or I'm going to try and find one so I can show you. So real quick, I'll preface that question by saying, if you see 2 of the 8 and airway is not one of the 2, maybe it's sepsis and hemorrhage, the way you're going to see it on the boards is you're going to see it as this person is septic and receiving antibiotics, whereas this person just returned post-op and now has a blood pressure of 80/40 and a heart rate of 120. So you've got 2 in there, but one is already being treated. So we're not freaking out about it. So that's kind of the way that it is. So yeah, exactly. One of my students just put it, like, what more can you do? And I think that's what we discussed it when we did our questions together, was what more could you do? So if this person is septic, they're receiving IV fluids and antibiotics, but what more are you going to do? Not much, right? So cool. All right. So again, use the method. So which one are you going to call back first? So I start with number 4 and I do not make a decision. Don't go to number 4 and make a decision. Compare it to number 3 and choose between one of the 2 with prioritization. What are you freaking out about? So between 4 and 3, I've got an 86-year-old with gout who is prescribed, look at the words, who is prescribed colchicine versus, and who's got diarrhea and not feeling well. Okay, cool. Versus a 78 prescribed warfarin, increasing headaches and gait disturbance after falling a month ago. So between the 2, which one am I freaking out about? I'm freaking out about 3, right? I'm freaking out about 3. Now I go on to number 2. I compare 3 to number 2. Worsening headaches, gait disturbances with the bleed risk, or a female with pneumonia taking antibiotics who reports vaginal discharge and itching. What's going on with this elderly patient? It's unexpected. I don't really care about this vaginal discharge and itching. We can treat that, no big deal. Now I compare 2 to 1. Look, at this point, I'm sitting pretty, I'm at 50-50. So just using the method, you should be able to narrow it down to 2 answer choices. Now, I look at a 20-year-old college student who's getting a ring-like red bullseye shape, itchy leg rash after hiking in the woods 2 days ago, or this person who's on warfarin now is increasing headaches and gait disturbance after falling a month ago. I asked myself, which one of asked graph is this? So which one would you think this is? 100%, this is hemorrhage. That's Lyme disease. Number 1 is Lyme disease. 100% this person is hemorrhaging. They're actively hemorrhaging. So you have to see that you're looking for this person. And if you look at it, they're on an anticoagulant, right? And they have a subdural hematoma. They are 100% hemorrhaging. Not only that, I can even say this person has an altered mental status, increasing headache and gait disturbances. So look, you have to look for one of the 8. So let's see if we can see another one. All right, so we've got same thing. Which client? So this one is a little bit of an outlier, but which one are we freaking out about? So there's a couple of things that do fall out of ask graphs. So let me digress to that a little bit. The things that fall out of ask graph, and I'm trying to incorporate them. So one is going to be transplant and transfusions. Transplants and transfusions, they don't fall into ask graph, but they're ones that you have to monitor because this person can have a they can reject the transfusion or the transplant, and they can tank really quick. The other one is reproductive. And what part of reproductive, or what reproductive emergencies could we have? Testicular or ovarian torsions, and priapism, which is a prolonged erection. So reproductive, you got testicular and ovarian torsions and priapism. We have to attend to these clients real quick. And the other one that tends to show up is overdose. And we're going to see that here. Overdose is going to be something that we're freaking out about. Anytime you see the words overdose, cocaine, opioid would be airway, but still, overdose is going to be one of them. So these are the ones that don't necessarily show up as much, but they are also something that we're freaking out about. And compartment syndrome, thank you, when my students reminded me, compartment syndrome. So look for that neurovascular compromise. These are in addition to ask graph, yes. These are like, they don't show up as frequently as ask graph. Okay, so these show up less frequently, but just so you kind of get an idea of what's out there as well. So yeah, so as you guys had said, that this person has an OD, so we're concerned about that. All right, so now let's look at another question. So again, which client are you gonna assess first? Initial priority, most concerning, urgent. Who are we freaking out about? Who are we freaking out about? So you got a handoff report. So we start with number 4, compare it to number 3. So you got dysphagia and a sore throat who has an NG tube to administer contrast media for an abdominal CT scan versus a person with bacterial peritonitis following surgery for a ruptured appendix who is receiving tobramycin and has a temperature of 101. So yeah, which one are we freaking out about? I'd probably be more concerned about 4 because look, We did see one of the 8 here, but guess what? They're being treated. They had peritonitis because of the fact that they had a ruptured appendix. Well, we did surgery and we're giving them antibiotics. No big deal. So that's how you're going to see the 2 at the same time. It's expected. We've already taken care of them. What more are you going to do? Nothing. All right. So we get rid of this. Now we've got a client with alcoholic cirrhosis who has coffee ground NG drainage, blood pressure of 90/60, and a pulse of 110. So which one of these 2 are we freaking out about? So we've got dysphagia and a sore throat who has an NG tube. Well, that's kind of expected, is it not? They've got an NG tube in, so it's probably going to be a little bit uncomfortable, right? So yeah, that's expected. But what about this one? What's going on with this person? Yeah, they're hemorrhaging. They're hemorrhaging. So we've got a paralytic ileus following colon resection who has abdominal distension, no audible bowel sounds, and nausea. So which one are we freaking out about between these 2? Again, find me one of the 8. Find me one of the 8. All right, same thing. Which one are we going to see first? Prioritization. Which one are we freaking out about? Compare 4 to 3. What? Compare 4 to 3 and ask yourself, which one are you freaking out about? An 11-year-old scheduled for ear surgery today, no parents at bedside, or a 7-year-old just returned from a CT and no parents at bedside. Okay, maybe the one that is gotten a procedure, I would take that one over somebody that's scheduled in the future for something. Now I compare 2 to 3. A person that just got back from a bronchoscopy, a parent is at the bedside. So what are we worried about with the bronchoscopy? What could potentially happen? Exactly, airway, airway, airway. Ask graph. So I'm eliminating 3, and I'm looking for a 2-month-old awaiting evaluation for a possible hip dislocation. So I'm freaking out a person who had a bronchoscopy because their airway could definitely be compromised. Look, just saying, we've done 4 questions. 3 of the 4 fall into Ask Graph. If you're seeing 75% of your questions and you're getting them right, you're passing your exam. So you have to think of that. The board exam is a game of averages, right? You're competing against everyone else. If I'm equipping you with these tools and tips and tricks, you're walking in, you're not feeling bad about going into that exam. If you ask the students that have passed, it's like, yo, I didn't feel like I wasn't scared or as anxious, and I'll work on that with you. There's not one student in here that's a current student of mine that I don't respond to within 24 to 48 hours. 100% I respond to every one of you. And I still have like, let's see here. We got 132 text messages. That's it. I'll get them done by tonight. I 100% respond to everyone. So yeah, look, we're shooting 75%. So yeah, absolutely. Nice. Almost 500 people. So yeah, absolutely. Let's continue on and continue to use this. So let's see. 70-year-old client. So again, what are we freaking out about? So these are all prioritization questions. So I'm just going to kind of go through them fast so we can see as many as possible. So that way you guys get exposed to them. So we've got, compare 4 to number 3, and let's see what we got. A 70-year-old with left lower abdominal pain and diarrhea for 2 days, or a 60-year-old pain with swelling, swelling, erythema, warmth in the right leg. Wait a minute. Why? And I say this all the time: age, weight, gender, anatomical location. Why are they giving it to you? Why? Ask yourself that. Well, I'm suspecting a DVT. Which one of Ask Graph is DVT? DVT can lead to a pulmonary embolism. That's why we're freaking out about it, right? So it becomes airway. 100% it becomes airway, right? So we got a 45-year-old with type 2 diabetes who's traveling and lost their insulin. Okay, well, DVT, I'm worried about airway. If that dislodges, it's airway, 100%, right? A 25-year-old with sudden onset chest pain and a heart rate of 110. That one is a little tricky. Yeah, that one is a little bit tricky. That's why I was like, Okay, so the reason why, yeah, the sudden onset of chest pain is going to be something that we're going to be freaking out about. So again, we're still doing the method. So ultimately you got down to this. Now the keywords come into play here, right? So when I teach my students, when you talk to me the day before your exam or a couple of days before exam, or when I teach you in lecture, I'm like, look for those sudden onset, that acute last hour. Like, why did that word just pop in there? Why did the boards give you a young patient with sudden onset chest pain? This is unexpected. A 25-year-old should not have sudden onset chest pain, right? So I'm freaking out about that more than this, because with this, yeah, are we worried about airway happening? Yes. Is it currently happening? No. So between the two, when I get down to 50-50, using the method, I'm choosing the one that scares me a little bit more, because with this one, I can immobilize them and I can put them on blood thinners. With this one, what's going on? Like, I have no clue what's going on. With this one, I already know what I got and I know what I'm going to do. With this one, I have no clue what's happening. Let's get a workup, right? So I'm freaking out about it. Exactly. All right, so what am I freaking out about? I don't have discounts for UWorld. And for anybody that signed up for the course that is military, send it in and they will give you a refund if you didn't know about the military discount. But you have, so you have to just show the proof to them. All right, so we've got a person receiving antibiotics who has new onset vaginal itching versus neck dissection, difficulty chewing. I'm definitely keeping 3, exactly. We're looking at this, why? Neck dissection, difficulty chewing. Post-mastectomy, reports numbness at surgical site. Okay, probably expected. Now I'm down to 50-50. We're in a full body cast. Now we got abdominal pain and bloating versus a neck dissection who reports difficulty chewing. Now look at this. We're down to 50-50. This person has a neck dissection, but they're reporting that they have difficulty chewing. So what? They're reporting it, right? They're reporting it. So now this person has a body cast with abdominal pain. So this is a little bit outside of that. Yeah, it's the compartment syndrome. It presents like compartment syndrome, exactly. So that's what you're concerned about here. So it falls into one of those outliers that I talked about. All right, so now we've got, which one are we freaking out about? Pareto for a client with myasthenia gravis, exacerbation, reporting difficulty swallowing. So which are you going to give first? Which medication are you going to give first? So let's see. Pain for someone who's got terminal bone cancer or lung cancer, we're going to give them, I'm more worried about the person with difficulty swallowing. Metformin for somebody who's got glucose of 285. Look, you could have a glucose of 285, you could have it of 500. I don't care. I've got time with you. I've got time, right? People walk around and they don't even know they got this. So don't freak out about it. And somebody who's got aspirin with the history. So which one of these is this? Which one of Asgraf is this? 100% airway. Yeah. All right, next one. Which one are you going to see first? So which one are you freaking out about? 67 with hepatic encephalopathy who needs a first dose of lactulose, or a 42-year-old admitted with pyelonephritis who needs antibiotic first. So I would say, yeah, I probably would be a little bit more about the altered mental status between the two, for sure. Now comes one of those outliers, right? So we've got 34 started on blood transfusion 10 minutes ago who reports chills, itching, and back pain. Yeah, this is not just an outlier, okay? This falls into Asgraf. Which one of the two is it falling into? What can happen with transfusions? Which one of ask graph can happen with transfusion? Sepsis, thank you. It still becomes one of ask graph. And then we got opioid withdrawal, who cares? Suffer, deal with it. But look, if we've got transfusion, you have to be concerned about this person developing an infection or hemolysis, which becomes hemorrhage because their body's not accepting the transfusion, right? So if this was DIC, this would be hemorrhaging, respiratory airway, whatever it is, we still have some sort of ask graph in there. All right, so same thing, who are we freaking out about? I got a person with inguinal hernia who's got abdominal pain, 10 out of 10, reporting bloating, nausea, vomiting, versus infected venous leg ulcer, already prescribed Vanco, who has a dressing saturated with yellow foul smelling discharge. Yeah, what's going on here? Right? What's going on here? Maybe some sort of peritonitis, maybe some sort of strangulation. Yeah, absolutely. All right, so we got rid of 3. Now let's compare that to number 2, taking diphenhydramine, so Benadryl, for urticaria, who reports difficulty urinating and increasing lower abdominal pain. So yeah, who cares? That's expected with long doses of diphenhydramine, right? Because I told, in our lecture, it's got anticholinergic properties. Give it to an elderly patient for 3 days and watch them not pee. Client scheduled for hemodialysis in an hour who has a serum creatinine, okay. Scheduled. Look, if a person is scheduled for something, you got to really consider why are they scheduled for hemodialysis? Yeah, that's why we're doing it, right? We're doing it because the creatinine level is elevated. So yeah, what's going on here? Find me one of the 8. Peritonitis, inguinal, it's a GI tract inguinal strangulation, right? So find me one of the 8. So who are we freaking out about? All right, so I've got about 10 minutes before we wrap up. Should I keep going with prioritization questions, or would you like me to switch over to this Pharm? I'm getting mixed. Pharm. All right, cool, perfect. All right, that seems to be consensus. All right, cool. So let's get into some Pharm. Man, y'all don't like Pharm at all, huh? I feel like Pharm is the one thing that people absolutely despise. If there's a consensus, it's Pharm for sure. All right, so let's do some GI Pharm. Let's do some GI Pharm. So let's talk about ulcers. Oops. All right. So in our GI tract, we can irritate our stomach. And that's called gastritis. Gastritis. Of course, I'm spelling all types of wrong. Gastritis. So no, ask graph is only for prioritization questions. So don't get it mixed up. Only for prioritization questions. So, all right, so gastritis, we can irritate our stomach. So what are some things that can cause that inflammatory process or that can irritate our stomach? Alcohol, smoking, caffeine, chocolate, spicy foods, nutrition. But what's something that we can take over the counter that is really bad for us if we're taking it consistently? NSAIDs, right? So we take NSAIDs consistently. And on the boards, I want you to realize this. If somebody is taking NSAIDs for an extended period of time, we're freaking out about it. Why? Because ultimately it can cause an ulcer. How does that happen? Well, first and foremost, NSAIDs are super high yield drugs. Because why? So just bear with me. I'm going to try and get through this a little bit quick. It will be on YouTube, so don't freak out if you don't see this. So yeah, we're at risk for bleeding. We're at risk for contraindication with warfarin. We're at risk for ulcers. It can ruin your kidneys. So what levels are we checking? BU and creatinine, right? So with all these different things that can happen with NSAIDs, we know that the boards are going to like to ask them because it's very commonly abused and people don't know about it because they think it's over the counter. Oh, I can take it, no big deal, right? So we have to know certain contraindications and we have to know certain side effects. So what happens is NSAIDs, now I'm going to get a little bit into depth here. And NSAIDs, they decrease prostaglandins. Prostaglandins are responsible for the barrier in your stomach that protects it from acid. So you see, if I decrease prostaglandins by taking an NSAID, that protective barrier that I have from the acid is going to start to thin out. If I don't have that protective barrier, what happens to that stomach lining when it's exposed to high amounts of acid? It will start to ulcerate. Exactly. So if we've got stomach ulcers, look for a person. What are some signs and symptoms you're going to see? Perfect select all that apply question here. What are some signs and symptoms if this person is actively bleeding? How about some blood in the stool? How about fatigue? Because they're now becoming anemic, right? Abdominal pain, right? Coffee ground emesis. Select all that apply. It's just asking if you understand what's going on here. It shouldn't be that complicated. In general, for the boards, when you look at risk factors and signs and symptoms, look for those to be your select all that apply questions. Not all of them, not all select all that apply are going to be those, but the risk factors and signs and symptoms are a great way to ask select all that apply questions. So now I've consumed NSAIDs. I've deteriorated that inner lining of the stomach, and that acid is constantly eating away at the stomach. So now we've got ourselves an ulcer. And if we've got an ulcer, we're going to do first and foremost what? Stop the offending agent. Now, if that stomach lining is gone and we've developed an ulcer, we're going to give them a medication. We give them a medication called misoprostol. And what does misoprostol do? Well, it increases prostaglandins to build that barrier back. And look at the root of that medication. It's got prost in it for prostaglandins. Where else do we see this drug? Cervical ripening and OB, good. Cervical ripening. Somebody had said something about YouTube Live. Ooh. Yeah, that's actually a really good idea. Do you mind emailing that or texting that to our Instagram, please? That's actually a great suggestion. We didn't max out today. We were close, so we didn't max out, but I'm sure we'll start getting there as we get bigger. All right, thank you so much for that suggestion. I really appreciate that. That's a great idea. So now, yeah, so yeah, that's kind of, I talk about that when we get into to ulcers, which one is relieved with food, which one is not. But so that's your NSAIDs, that's your misoprostol. And then now let's talk about another one that's high yield in general that I want you to know about is antacids. And the reason why I chose antacids is because there is one type of a question that comes up that says, which of the following statements is needs further intervention, further teaching, right? One of the 5 types of questions. And that question is going to be somebody that's got an antacid and saying, I'm going to take this medication with antacid. Absolutely not. Absolutely not. So you're never going to give antacids with medication, never, right? So for the sake of the board, it's an easy question. Further teaching, further intervention moment. Which one of the following statements would require further teaching? So you always give antacids by themselves. How long after consuming an antacid are we going to be able to take medication? 2 hours, right? So antacids, what? Your aluminum hydroxide, your calcium carbonate, your magnesium hydroxide, these are all what? Your Tums, your Rolaids, right? So these antacids are used for instant relief when you have acid reflux. This is not a chronic condition. This is an acute setting, where you're developing acid that is refluxing up that lower esophageal sphincter. What are we going to give to somebody that's got gastroesophageal reflux disease? Now it's become a disease process. With them, you're going to want to give them a proton pump inhibitor, because in the stomach, that hydrogen is a proton, right? Hydrogen is a proton. And whatever is pumping it into the stomach, we're going to inhibit it. So you give them a proton pump inhibitor, which end in prazole. So omeprazole, esomeprazole, pantoprazole, lansoprazole, these are all your proton pump inhibitors. Somebody's writing all over my screen. So yeah, proton pump inhibitors. So just to kind of wrap this up, what are some side effects of proton pump inhibitors that we are going to be worried about? We're worried about this person. We're changing their pH, so we're worried about C. diff. Excellent, right? I know I got hacked. So we're changing the pH of the stomach, so our normal flora can overgrow. That normal flora is Clostridium difficile, right? But not only do we change the pH of the stomach, we also decrease the absorption of calcium. So if we're not getting calcium, what are we going to do first? First and foremost, let's supplement it. And what goes good with calcium? Calcium and vitamin D. Calcium and vitamin D. And then I had a student that told me that she had gotten a question about iron and vitamin C. So remember, those are synergistic. I talk about it in my nutrition lecture. So vitamin C and iron, vitamin D and calcium. So we've got decreased calcium absorption. So now we've got to supplement them. And then beyond that, we're worried about them developing osteoporosis, right? So if they develop osteoporosis, how are we going to find out or figure out that they have osteoporosis? What are we going to advise them to do? What are some suggestions we're going to make to them? How about a DEXA scan or a bone density scan? Absolutely. Absolutely. Cool. Again, course starts next week. There is, after this, a webinar. If you have questions regarding the course, you can ask me. It's a one-on-one, or not one-on-one, but it's an open forum, so you'll be able to ask me. I'll explain to you what to expect from the course. I know 500 is a big investment, but you can see from the students that the webinar is 100% free. It's just for me to answer questions for students that want to potentially take the course or are interested in taking it. No, it is a different link. I'm going to start it. I don't know about UWorld. I don't work with UWorld and their military discount. We do have a military discount. If you are, you can just send the ID into our email, contact@NCLEX High Yield. So, and for those, yeah, so if you have questions like that, like my test is end of June, so on and so forth, go ahead and go into that webinar and I'll answer all those questions. All right, you already know what I am about to do. So I need everybody's cameras on, cameras on, cameras on. All right, here we go. Where are we at here? Stay with me, stay with me, stay with me. All right, here we go. What's up, everyone? Aloha from beautiful Hawaii. My name is Dr. Zeeshan, and I am doing a free weekly Zoom from here, and I got beautiful people that join me, almost 500 beautiful people joining me here on vacation, still doing it for y'all, because guess what? If you are not here, what is you doing until next Wednesday? See you guys then. Take care. All right, everyone. Thank you so much for joining me. Again, if I offended anybody, I apologize. I never mean to offend anybody. If I can get better, please, please, please let me know how I can. For those of you that are interested in the course, please join me for the webinar. The link is in our Instagram bio. So until next weekend, thank you guys so much for joining me. Enjoy, study hard, take care.